I think I see that now. All right, I believe we have started recording, so I am going to call the meeting to order. And this is the regular Board of Health meeting for the Renfrew County and District Health Unit. I'm going to start by acknowledging that the Renfrew County and District Health Unit is located on the unceded territory of the Algonquin and Anishinaabe people. We honor the land and the peoples of the Algonquin and Anishinaabe, whose ancestors have lived on this territory since time immemorial, and whose culture and presence have nurtured and continue to nurture this land. We honor all First Nations, Inuit, and Métis people, their elders, their ancestors, and their valuable past and present contributions to this land. Miigwech. So yes, I'm calling this meeting to order, acknowledging that we have everyone is in attendance. Thanks, Peter. I didn't get to say hello to you on arrival, but welcome. And just to let you all know that Neil wrote to let us know that he was delayed and will join us as soon as he can. So we'll all try to watch for his arrival to welcome him into the meeting. So we'll start with the agenda approval, and I'll call for a motion to approve the agenda. I had my hand down. So Troy is moving. Did we have a seconder? Jennifer, all in favor? Carried. Thank you very much. Any declarations of conflict of interest? For the record, there are no declarations of conflict, and to my knowledge, we have no delegations today. So I'm going to look at the approval of the minutes for previous meetings. And first and foremost, we've got the meeting minutes from June the 25th, 2024. So I'm looking for a mover, Jim, and seconded by Troy. Thank you. All in favor?
I just wanted to speak to, before we vote, Joanne.
Yes.
I have an issue with the approval of the minutes, which include the letter from yourself to the board regarding the response to Peter's letter. Because if we approve these minutes, then the position of the board is that we're adopting this as the board's position, when in fact this letter was never approved by resolution by the board. So if the vote's going to be taken, I would like a recorded vote.
We can take a recorded vote and see where we end up on that. And if we need to, I suppose we can do, what do? We sever the letter from the minutes if we need to.
Yes.
And I'm okay with that too. I don't have a problem with that particularly, but let's take a recorded vote for starters. Are people prepared to be in favor of those minutes? All in favor? Let's just see. Let's call a recorded vote. We have 3 that are willing to put their hands up in favor, 4, 5.
If I
So
might,
let's call it as a recorded vote then. And
if I might, Chair, it might
Sure.
be in our best interest to just go ahead and sever it and make it a separate issue. Just sever that portion and go ahead and vote on the rest of the minutes, because the rest of the minutes are fine. But I think the dispute would be around that letter. So you might want to just
right. Does the
Yeah.
whole board agree with every single thing in the letter? Do we have to take a motion to sever something, or can we just sever it? We have to take a motion. All
No,
right.
you need a mover and seconder and a vote to sever.
All right. Mover to sever the letter is whom? James, I'm thinking, because he raised it, correct? And seconded by Jennifer. Thank you. All in
Me.
favor of that's what I said, Jennifer. Thank you. All in favor of severing the chair's letter of April. Okay, good. Thank you. That's carried. Then we can take the minutes without the letter as part of the record of the meeting, and then call for that motion, which we already had, which was Troy and Jim. Or did I have that backwards? It could have been Jim and Troy. But I think we had a mover and a seconder on those minutes. Melissa will have that more accurately than me.
Yes,
She'll have them in the
Chair,
right
it
order.
was Jim and then Troy.
Yeah, Jim and Troy. That's what I rethought myself. All right. Well, let's call the question on the minutes. All in favor? All right, the June minutes are carried. The letter's been severed. Let's move to the minutes of September the 24th. Peter, are you moving those?
Yes, I
Thank
am.
you.
Thank you.
Thank you. Seconded by Carolyn. Thank you, Carolyn. All in favor? Those minutes are carried. Perfect. Thank you. All right, so let's go to the staff reports, then the medical officer of health report to the board, and we'll call Jason up for that. Thank you very much, guys.
Hi, good morning, everyone. Good to see everyone. I'll start off my report with something that always keeps us very busy in the fall season, which is our seasonal immunizations that we offer. So I'll start out with COVID-19 and flu. So we received our first batches of these vaccines in the first week of October, and then promptly began our distribution right away to hospitals, long-term care homes, and our healthcare providers. And with the focus, as you know, for the bulk of October being on our high risk and priority populations. And so to help serve those populations from October 11th to 24th, we hosted 9 community-based clinics for COVID and flu. And we will be continuing to offer additional clinics as we go throughout the fall. And we're also, to further support the vaccination of many of those priority groups, we will be providing mobile COVID-19 and flu clinics for our retirement homes and other congregate settings. Long-term care homes have been provided with the vaccine and generally implement that on their own with our support. And then just as of yesterday, the eligibility for COVID and flu vaccines opened up to everyone 6 months of age and older, which is exciting. And so that's available at our RCDHU clinics, as well as participating pharmacies and healthcare providers. And just as a reminder, vaccination still remains an essential way to prevent respiratory illnesses for all residents, and I'd strongly recommend it for everybody 6 months and older. But in particular, for older adults, 65 years and older, it's essential to provide the protection against these illnesses. And then also just a quick reminder that it's recommended to receive the COVID and flu vaccine at the same time, as it's a more convenient way, and it's safe and provides the same amount of immune protection against both. So next, I'll talk a bit about an area where there's been a lot of development and change in the last year or two with what we're doing for respiratory syncytial virus, or RSV. We've had some new tools added that we can use to help protect the community. And so the first one that I'll talk about is our older adults high risk program, which we offered for the first time starting last year, and we've been continuing that work this year. So this is where we're able to provide the RSV vaccine to certain adults that are 60 plus and have other risk factors. And one of the ways that we're doing this is providing mobile clinics and retirement homes. And as of October 22nd, 9 out of 11 of our mobile clinics have been completed, and we're planning to finish those up ASAP. And then just a note as well for RSV, we also provide this vaccine to long-term care homes so that they can offer that immunization to their residents. And for any other eligible individuals in the community or elsewhere, they can receive the RSV vaccine through this program from their healthcare provider or by booking an appointment with us at RCDHU. And I've just included a link there for more information on the details of that. And then also very exciting this year, for the first time now, we're able to offer an infant and high risk RSV protection program. And what we're using in this case, it's called a passive immunization agent. It's called Nursivimab, or the brand name is Beyfortus. And it's like a vaccine, but the difference here is that we actually provide the antibodies that the body uses to fight infection pre-built, so that rather than in a typical vaccine where we give a stimulus and then the body produces its own antibodies. So here we're directly providing the antibodies. And we did receive our allocation of that in the second week of October. And all infants under 12 months of age are eligible to have this immunization, as well as some children that are up to 24 months old and have other risk factors. And so the ways to access it are either before discharge from the birthing hospital for infants, can also be accessed through people's healthcare providers, or of course at an RCDHU clinic, we'll be offering it as well. And then I just wanted to note that you may have also heard of another immunization or vaccine that's called Abrysvo that can be provided to pregnant women between 32 to 36 weeks gestation. The goal with this vaccine is also to develop those antibodies and then provide protection to the baby before they're born. However, while this is an option for some people, for the general population, the National Advisory Committee on Immunization actually recommends instead using nirsevimab or Beyfortus, the immunization for the baby. And for most people, you just need one or the other because they're really trying to achieve the same goal. And the reason for prioritizing nirsevimab is that it's due to its effectiveness, its length of protection, and its safety profile. So that's for most people what we recommend, but anybody who's interested in the vaccine received during pregnancy can, of course, speak about that with their healthcare provider. And then the last piece that I'll talk about with the immunization programming is around our grade 7 school-based clinics that we do every year. So we are working our way through our first round of this. And again, these are immunizations for hepatitis B, meningococcal disease, and human papillomavirus. So as of October 11th, we'd completed 18 school-based clinics, and we'll be aiming to finish that by the first week of November, so very shortly. Under healthy environments, I have a few quick updates for what the team is focusing on right now. First of all, I did just want to reflect on National Environmental Public Health Week, which was celebrated this year in the last week of September. And this week's really about just acknowledging the hard work that our public health inspectors and other environmental health professionals do every day, and all the work that they do protecting our health that really spans so many different domains of our life. It's pretty amazing. But some of the things that I've highlighted here are, protecting us from foodborne and waterborne illness, vector-borne diseases like those from ticks, rabies, climate change, environmental disasters, and other health hazards. So we're very thankful, as always, for our Healthy Environments team. I'll give you a quick update on our vector-borne disease surveillance and control. So we are completing the second phase of our active tick surveillance, which consists of tick dragging. And we did begin that in September. It's continuing a bit later than usual because we need to wait for ideal weather conditions to ensure we get accurate counts. And so we've been delayed a bit into October in completing that work. Also, we're for our recreational water inspection work, we've completed our third round of inspections for these indoor facilities. So that's pools and spas. And as we're required to complete 4, we're on track to finish our final 4th compliance inspection by the end of the year. So happy to see that. And then lastly, under healthy environments, we are continuing to work diligently on inspecting and ensuring the safety of our small drinking water systems across the health unit area, of which there are over 300 of these. So it's a lot of work for the team. So we, and then we're also prioritizing them as many of our facilities that have these small drinking water systems do shut down for the winter. So we're trying to complete the last few priority systems that we can before the end of the season. I'll give you an update on respiratory illness activity across Renfrew County and District, so which is obviously a key focus of this time of year. So we have seen our outbreak activity increasing significantly starting in September mostly, and it peaked at an average of about 3 new outbreaks each week, and COVID-19 remaining the dominant pathogen that we're seeing, causing most of these infections that lead to outbreaks. On the individual testing side, we still have not had any influenza cases reported to us yet this season, although some of our neighboring health units have had that, so it's just a matter of time. However, in contrast, our COVID-19 testing positivity rates have been high in Renfrew County and District, and actually higher than what has been seen in the province as a whole, where they've only really been seeing moderate levels of testing positivity. In terms of our hospital admissions, those remain high with an average of about 2 to 3 new admissions related to respiratory illnesses each week. And we're also monitoring our emergency department visits. Those started a bit later on, but have been increasing gradually and have just this week reached a high level as well. So overall, our respiratory illness activity, particularly with COVID, has been high since this late summer. And while we did see a bit of a decline in our more recent data, we still expect that overall this impact of respiratory illnesses locally is going to continue to increase in the next couple months, particularly as we see RSV and flu really starting to take hold. So we'll have to continue watching that closely. And as always, we'll be responding to outbreaks and diseases of public health significance as they come up. So under that health promotion division, I'll give a update on our school health and well-being work. So we did launch a new webpage called Tools for Educators, where we've curated a lot of different resources for educators across Renfrew County and District to help support them to deliver the Ontario Health and Physical Education curriculum. We also sent out a fall newsletter to all our educators at the end of September, which included a broad array of topics, but some of them were You're the Chef, our food literacy program, as well as school-based immunizations, information around tick-borne disease prevention, some education on safer routes to schools, and then vaping prevention and cessation supports, in particular related to the policy procedure 128, which is the provincial code of conduct. And so also in support of PPM 128, we developed and distributed a comprehensive vaping school resource, again, with a number of curated resources to support them in their work around vaping. And then lastly, we did identify the importance this year in particular of providing everyone with safe school travel resources, as we did see the lack of availability of busing for the first while of school at our two major school boards. And so wanted to make sure that injury prevention messaging got out to everyone. So now just a couple more updates. You might remember our SPRITE program or syphilis point of care rapid testing and immediate treatment evaluation. So I've given some updates on this before. It's a collaborative project with Kingston, Frontenac, and Lennox and Addington Public Health that provides point of care testing and treatment if needed to our vulnerable populations. And so this has been going off quite well. Our outreach team has actually nearly surpassed our original target of being able to provide testing to 50 people before the end of the year. So we've revised our goal and now are aiming to provide testing services for syphilis, HIV, and hepatitis C through the program to 75 people. And we've expanded our outreach network as well to additional locations. You can see here, so Barry's Bay, Arnprior, Renfrew, and the Algonquin-Zipiquaquinagon Community Health Center. And then something we've been finding beyond just the testing and direct treatment aspect of the program is it's been a really valuable way to connect with people and inform them about other services that we offer at the health unit and connect them to a broad array of those services as needed. So been really happy to be a part of this collaboration. I just have a short update on Let's Grow in our healthy growth and development area. So this is a program where we, in addition to well baby checks, we also provide immunization services as needed and further referral and system navigation. So we've expanded our clinics under this program. So now that we can offer it in 4 different areas, Pembroke, Barry's Bay, Renfrew, and Arnprior, and happy to be able to expand that. And then my last update is on the Renfrew County and District Drug Strategy and work around this. So we are continuing to chair the steering committee meetings for this. And we had our 5th meeting in September. And at that meeting, we had a presentation from our Community Safety Working Group, as well as an update on the Joint Community Safety and Wellbeing Plan for the Upper Ottawa Valley. We are still, the Community Safety Working Group still working on their preliminary recommendations, but they have identified 5 areas of focus that I have here. So enforcement, social order, safe disposal of sharps, communication, and complaint reporting mechanisms. And we did publicly announce the work on the drug strategy on September 11th through media release. And then we also had a website launch, and we've linked to that here. And a number of the drug strategy partners successfully collaborated to submit both an intent to apply and then our full proposal for a local homelessness and addiction recovery treatment hub. And so that was submitted on October 18th and waiting now to see, hopefully not too long, about what the result of that is. And then lastly, our implementation and integration planning for our mobile substance use service through our successful funding from Health Canada and their substance use and addiction program, that's ongoing. And obviously with strong collaboration with the MESA initiative. So a lot going on in this file, and excited to see the continued progress. So thanks for the chance to give an update, and I'm happy to answer any questions.
Just looking to see, okay, yeah, James has his hand up.
Thank you. Excuse me. Thank you, Joanne, and through you to Dr. Morgenstern. I just wanted to pass on thanks on behalf of the Shaw Woods Outdoor Education Center Board. The tick dragging that was done on the trails and the results that were passed on to the board, they really, really appreciate getting this information because they provide that information to the educators at the Outdoor Ed Center. And it helps them build the awareness for any of the groups that are coming out there, that they certainly take the precautions and do a thorough check when they're done their sessions at the center. And I think it's important to note that of the ticks that were picked up in the drag in the spring, over 50% of them tested positive for Lyme. So it certainly is becoming more of an issue, and we certainly are hearing more and more people talking about having to pick the ticks off their pets, etc. So appreciate the ongoing work that you and your staff are doing in that area. And the other question I had was just in regards to the small drinking water testing. Is there any more current information from the province on whether they are still planning to discontinue funding that, or have they had a change of heart? Thank you.
No problem, and glad to hear that this was the information we provided was helpful. So thanks for passing that on. In terms of the small drinking water systems, that's actually a bit separate, I think, from what we were discussing before, which is the free well water testing provided through Public Health Ontario. So that's I'll come back to that. But in terms of the work we do around small drinking water systems, this is primarily campgrounds and things like that, where when they're not a municipally managed water system, then we as public health step in and provide inspection services for those small drinking water systems, and there's not anticipated to be any reduction in that. So that works really important, and there needs to be oversight and inspection of those sites. However, with the well water testing, we haven't heard any updates yet on what Public Health Ontario's plans are. When we come to correspondence later, there is another letter from a local board of health from Sudbury, just again advocating for this to be continued, and I think there's been pretty broad support for that. So unfortunately, no further updates on it at this time.
Thank you, Jason. Are there any other questions on the medical? Peter, yes, and then Jennifer.
Thank you. Not a question, but just to inform that with regards to the well water testing, I brought it up at AMO last month. I'll bring it up again at the end of this month, because I think it's a fairly significant. What I'm trying to do is find the numbers or an estimate of the number of wells in Ontario to capture how large an issue this is, but I think it's a fairly substantial number. Can't seem to get anything current. I'm still digging away at, but I will bring it up one more time, and just to let AMO Rural Caucus and County Caucus take another run at it. So we're not letting it die.
Thank you, Peter. On behalf of all of the rural residents who have wells, I know that's greatly appreciated. Jennifer?
Well, Peter just stole my thunder because I was going to say this is predominantly a rural problem, and I was going to all bring it to the Roma board as well, because it is such a significant thing to be losing. And once again, the province seeing only the urban settings of the province of Ontario. So I think we need to advocate hard for this. And I was actually really happy to see in correspondence that it hadn't fallen off other people's agendas, but I'm happy to bring it to the Roma board this month. And Peter, if you find out how many wells, would you mind sharing, please? Thank you.
Any other comments or questions on the Medical Officer of Health report? Seeing none, I will call for a motion. Do I have a mover? Mike DeManoir, seconded by Jennifer Murphy. Thank you. All in favor? That is carried. Thank you very much. And that brings us to our next staff report, which is our CEO report to the board from Heather. Thanks, Heather.
Thank you. Can everybody hear me okay? Hello? I'm not now.
Yeah,
I've
we can hear
lost.
you.
Oh, okay,
No,
okay.
we can
I
hear you. It's
thought
all
I'd
good.
lost my audio.
No, you're good.
Okay. So yeah, just to go through my report with an overview. So the ministry have nothing to report since last month regarding progress with the updates to the public health standards and the funding for public health review. So we continue to wait on this. They are continuing to complete prior year financial settlements, and the 2021 year has now been completed, and the ministry does agree with our audited results from that year. They are also working on 2022, so that should come shortly as well. It's a busy time of year for conferences and training. We just completed the board governance training session on October 21st last week, presented by Alpha. As well, the Alpha Fall Symposium happens November 6th to 8th, and they are holding an AI workshop as a pre-symposium session, and it sounds like that's going to be a very popular event. The annual board self-evaluation forms have been issued, and they are due back to Melissa by November 8th. These results help inform planning for board education, improve effectiveness and efficiency, and they are also a component of the accountability framework for boards of health. At the end of September, Dr. Morgenstern and I met virtually with the CAOs for RCDHU's obligated municipalities, including County of Renfrew, City of Pembroke, and South Algonquin. We discussed shared themes such as inflationary cost pressures, procurement issues and challenges with workforce and talent recruitment. Some examples of opportunities we touched on and we will continue to explore include areas like staff training, sharing of venues and physical space for staff events and other things, procurement, group purchasing opportunities, and even sharing of policies and procedures. So this list is not finite, but we will be continuing to seek creative solutions and opportunities. They were really good meetings. On September 26, RCDHU participated in the Renfrew County Municipal Day, which was designed to give elected municipal officials and staff an opportunity to visit and learn about municipal departments and partners. 2 members of the RCDHU team participated at this event, and I understand it was a great success. Dr. Morgenstern is representing RCDHU as a member of the executive of the Renfrew Area Administrators Group. The short form for that is RAG, which is an unusual term, but which will provide additional opportunities for shared services and collaboration. So this group is active again after the hiatus from the pandemic. We are also actively utilizing shared service agreements with other health units to backfill staff vacancies. And finally, I'm confirming that the recordings for the RCDHU virtual board meetings are now being posted to our RCDHU YouTube channel. And that is my report for today. Thank you.
Awesome. A lot has gone on. Are there questions or comments for Heather? Let's see, Peter first and then Jennifer.
Thank you very much. And first of all, thank you to our CDHU staff for participating in the Municipal Day. It's very important that we're able to share all of our information so that every municipality in every corner of their staff can act as ambassadors and offer good information. Increasingly, as we saw during the pandemic, municipalities are called upon to step way outside of their traditional lanes. They're expected to know intimately the resources available to them, to their residents. And so this was a great opportunity. So thank you. Just on my next point is under training. I I noticed on page 42, there's an executive assistant, administrative assistant fall virtual workshop. And it's an opportunity to speak about governance and AI, or to learn about governance and AI. So I'm wondering if it's, and I'm not suggesting that our staff aren't trained. I'm just suggesting that chairs come and go with respect to the chair, and members of committee come and go. And so it would be, nice if staff, one or two staff were trained on governance and AI. So it's AI, Board of Health Governance and Substance Use and Addiction. So if there is the opportunity and funding available to have staff attend that, I think that'd be a valuable resource to have a couple of people, especially on the governance side, because as we learned the other day, there's the Municipal Act is influenced by what, 228 or 272, I can't remember, different pieces of legislation, plus the Health Protection Act, all amalgams into our meetings. And so I think we need an expert on staff. So thank you.
Is this page 42 of the Alpha letter, like the Alpha newsletter?
42 of the whole package.
Of the whole
Um,
package? Okay.
Yeah, sorry. I don't know which one. I just printed it off so
Okay.
I'd have it in front of me.
Okay, because I know Alpha is putting on a session for EAs, so executive
Yes.
assistants only. So
Yeah, so no, that's
it's
the one.
limited to, yeah. So I believe, and Melissa, I believe you're attending that, and they're
Yes,
limiting
it's
it
for-
to.
Yes, EAs and a couple of our senior AAs are also attending, Heather.
Okay,
Perfect.
thank you.
Perfect. That's all I was asking. That's great. Thank you.
Okay, great.
It was a long speech to get there. My apologies.
Okay.
And Jennifer, you're next up.
I just wanted to extend my thanks for making sure that our meetings went up on our YouTube channel. Thanks for making that happen.
My
It
pleasure.
seems like that was awesome. It was thanks to input from Neil, I believe, that gave Heather the information after the meeting last month as to a direction in which to head to make that happen. And thanks and Troy, I see your hand up now. Thank you.
Yeah, I wonder if just if somebody could just elaborate in regards to the Renfrew Area Administrators Group, the RAG. I guess what opportunities are there in terms of efficiencies for our organization, and what do we hope to get out of that that partnership?
Sure. I mean, I could turn that over to Jason. I know that off the top of my head, there's banking agreements and financial opportunities and savings and et cetera. Jason, you want to?
Thanks. Yeah, that's at a high level. Yeah, some of the primary areas, I think. I mean, I've only attended one meeting so far, but just to give an idea of the membership, it includes CAOs from our municipalities, the dean of Algonquin College, the leadership from our local school boards, among others. So that's sort of who's at the table. At our first meeting, we provided a lot of updates in our respective domains, and one of the areas of focus for that meeting, at least, was on training, and in particular around Indigenous cultural competency. So there's a collaborative effort ongoing to actually train our senior management collectively there. So that's one example. But I know historically the group has also focused on collective banking agreements that can result in more favorable terms for all the individual organizations. And we are sort of, as we go along, just actively exploring those areas where we might find synergies as they come up.
So let's see, Troy, did that address your question? Good. Are there any other comments or questions on Mike DeManoir, thank you. I see your hand up.
I just wanted to say that it seems to me our current banking arrangements are a result of the RAG efforts.
Historic, like previous, when RAG was operating in the past, what was more active prior to the pandemic, I think is what you're saying, right?
Yeah.
And so I'm looking to see, thank you for that. Thank you. And I don't see any other hands up at the moment. Oh, and I see Tom. So next up would be a resolution to approve the CEO report. Do I have a mover? Carolyn, seconded by Mayor LaValle, Elder Ethel, thank you. All in favor? And that's carried. Thank you. And so next up on our agenda is the corporate operational plan and risk mitigation strategies, and that report is being presented by Tom. Welcome, Tom.
Good morning. Thank you very much for having me here today. Okay, so I'm pleased to present another quarterly update of our corporate operational plan. For the second quarter of 2024, we are able to show positive results for the status of all 8 2024 corporate operational plan priorities. And so as of June 30th, I can report that our first priority of maintaining vigilance and preparedness for emerging serious pathogens, which is a new priority for this year, is currently on target. Our second priority of effectively managing fixed costs, rising in excess of funding increases, is also on target for this quarter. Also on target was the priority of meeting staffing requirements for programs and services. And with the completion of contract negotiations with both unions, the fourth priority of supporting labor continuity was actually completed in Q1. Mitigating the impact of natural disasters, our fifth priority, was on target for this past quarter. And the priority of ensuring privacy in all health unit systems was also on target. The priority of ensuring the implementation of the corporate operational plan is on target as well. And finally, the priority of responding to the increase in drug-related harms, which is a new priority, is also on target. And we are continuing to complete activities for our 2024 corporate operational plan priorities, and I look forward to providing a third quarter update later this year. Are there any questions?
Peter, I do see your hand up. Thank you, Peter. And then James.
Thank you, through you to Tom, and thank you very much for this, Tom. But could you just explain when it says we're meeting our staffing requirements for programs, what does that mean? Because I think anybody who's paid attention to public health knows that we've been understaffed and had difficult times recruiting. So if you could just explain that a little fuller, please.
So some of the things that we have done for staffing requirements, I do have some activities here. That could probably be better answered by Patty, perhaps, about the actual staffing requirement numbers. But we do have a number of activities that we do within each quarter to achieve these goals. For example, we do have the HR generalist, which we've hired to the end of December. We cover capacity through the cross-training of staff for respiratory season purposes, ongoing training. So developing capacity through training internally as well.
Okay, thank you. I just, I think I was just trying to get reassurance for that we have the necessary staff for the programs and services.
Correct.
Thank you very much.
And then I said I always wrote down people's names, but I think, Jennifer, did you have your hand up or was it James next? James? Thank you, James. I had both your names down, but I think I missed someone else, but let's go with James.
Thank you, Joanna. Through you to Tom. Yes, thank you for the updated risk management report. I just had a question, I believe. Can you bring up the areas again? I think it was in regards to the inflationary pressures and the lack of appropriate funding. And I'm just curious, managing fixed costs rising in excess of funding increases. Again, what sort of initiatives are being taken to keep us on target? And I guess also in follow-up to Peter's comment, if it involves the vacancy of positions that aren't being replaced, but you're talking about cross-training so that other staff are picking up the necessary skills in some of those areas. Are there other areas that are being explored to manage the fixed costs?
So when it comes to actual costs and budgeting and that sort of thing, I'd probably defer that to Patty for additional information. Or to other members of our SMT.
Yeah,
Heather?
I mean, I can
Mhm.
just throw in off the top of my head because I don't have the risk management document is very large and we go through each of the themes and we record all of the different activities. But on a higher level, it's monitoring budgets, it's quarterly reporting, it's effective procurement, it's things like looking for opportunities for effective procurement programs and those kinds of efforts. That's an overview, a high level answer without getting into weeds.
Yeah, we don't, we do
Yeah.
want to try to stay at the strategic governance level, of course, at that higher level for sure. And I do think probably greater detail does take place at the resource committee as well. And Troy, I do see your hand up. But you just went off screen and you're still muted, Troy.
Sorry, I hit the wrong one.
There you go. There you go. We can hear you and see you.
Thank you. Maybe in the future, is there an opportunity just to put some sort of justification, just bullet points beside whether we're on target or not, and what are some of the mitigating measures that are in place? Just a few bullets would be maybe appropriate, just so that, because I have the same questions in regards to managing fixed costs. If I brought this to council, they're going to say, okay, well, you guys are managing your costs appropriately, so next year is there going to be an increase, not based on this. You know what I mean? And I think it'd be good. We need to be realistic in terms of that. That 1% funding annually funding is not really cutting it for our operation. And the same thing with the staffing. The reason that we are meeting those targets is because we have a bunch of different vacancies, so that we haven't really replaced those vacancies. So that tells a different story. So maybe that's a good opportunity in terms of the next report that we get in terms of the risk management report.
Are there any other questions or comments, James? Oh, and wait, Jason, I think you might have had your hand up first. Sorry, James. So
I just wanted to say something quickly that I think an important distinction, and Heather, please step in if you want to add additional clarification here, is not that we're saying that the overall situation is perfect or whatever, but we've planned a number of mitigation measures, and it's whether we're, with what's in our control, achieving those mitigation measures that we've outlined. So I think that's an important distinction.
That's exactly bang on, Jason. It's a case of reducing the risk. We're not eliminating. I don't think we would have that power. It's reducing and managing risk. This is the risk report. So we've identified those 8 areas that are the highest scoring, and they're scored by the committee at the beginning of the year. And then we work through strategies to mitigate each of those risks. And then we meet almost monthly to discuss, are those strategies on track? Have we done this? And it's a very, it's an excellent process for keeping you on track. So we know we've set all these mini goals, and then we meet and go, are we on that one? Is that one being accomplished? And also, are we seeing are there any changes to the risks? Are they getting better? Is there any big things? So as you see, we added, Jason, and you can talk about that if you want it, but we did add a strategy, I believe, number 8 as well, to the risks through the year. Does that help?
I think so. That was good. And I did see James had his hand up, and then Peter.
Yes, thank you, Joanne. And Troy brought something to mind for myself when he talked about just a little bit more information would sometimes be helpful. When I think of strategies to manage fixed costs and also look at program effectiveness, just knowing the advocacy that's happening and in what areas as a board would be very helpful.
Great. And Peter?
Yes, thank you. I should have been probably clearer in my monologue. I was just trying to I had confidence that we have enough staff, and I'm glad to hear about the cross training because that's a very valuable tool. But I was just trying to get reassurance for the community. I had comfort with it, but just to reassure the community that there is enough staff to cover off all the programs. So that, I think I led us a little bit down a rabbit hole by my long monologue, and I apologize for that.
Thank you. Now, I got a little distracted there listening and thinking about all the comments. I don't know, did I have a motion yet on the floor for accepting the corporate operational plan with risk mitigation strategies report? That's a mouthful. So I don't think I had a mover and a seconder yet for that. So could I please call for a motion with a mover and a seconder? Okay, James moving it and Jennifer seconding. Thank you very much. All in favor? And that is also carried. Awesome. Thank you. Where are we at now? Board committee reports. There are no board committee reports this month. So we are actually moving along really well. I'm wondering if we need a little stretch break. I'm looking at Carolyn. Should we have a 5-minute stretch break here before we move into correspondence?
Can I just ask why you're looking at Carolyn?
You are often the kindest soul on this group to remind me through a chat message to call for a stretch break.
Oh, I thought maybe I had a bladder issue. Okay.
No, but you've trained me now by texting me a couple times to remind me to give everybody a quick stretch break. So help keep me honest here, Carolyn. So I was wondering, but anyways, this is not directed at Carolyn, although she has trained me well. I want you to appreciate that. And I'm wondering, do people need just a 5-minute stretch break before we launch into the next bit? All right, thumbs are up. It is now, by my clock, almost 10 to 11. Let's try to be back in 7 minutes at about 5:02 or something like that. Thank you. All right. How are we doing? We're just past my 5 to 11 time frame, so hopefully, I think, hopefully everybody is back and we will get back to our correspondence, which is next on our agenda. I'm just kind of talking slowly to make sure that I see everybody back. Peter, Mayor LaValle, and Mike DeManoir. I think you guys are all back. You're not on screen, but I'm going to trust that you're back. So the first item that I have in my, wait a minute, let's get my pages lined up here. Where am I? Our first correspondence issue is our letter from James, which is now on our agenda in open. So I was rereading James's letter and my letter, and I don't know, you guys, which things we really, and I mean, a lot has gone on since then in terms of the staff accomplishing a number of the areas of collaboration in terms of the meetings. Of these points, the 7 points in James's letter. Oh, and I also wanted to say, I know in point number 1, James expresses a sensibility that I've been dismissive, and I'm sorry if that is how it came across to any of the readers. Certainly not trying to be dismissive of shared services, very much a fan, in favor, constantly looking for collaboration is kind of my place that I come from. And so there was no intention to be dismissive. And if anything, there may have been a feeling of reacting. I think I was reacting to the letter from the warden and also the document from the county, the collaboration paper from the county, that in fact is clearly comes out to my mind when I read it as a merger, and the Renfrew County and District Health Unit and County of Renfrew collaboration, and the Renfrew County District Health Unit was not engaged in any way to contribute to this paper, which in and of itself seems ironic that a collaboration paper is only written by one of the parties and not included anything from the other. So if there was a bit of dismissiveness, it may have, or a feeling of dismissiveness, because I certainly didn't intend that. I was, however, absolutely countering and trying to counter any sensibility of a merger with the county. And our motion in March was not about a merger. And it seemed from listening to county council, YouTube meetings and other matters, the collaboration paper, etc., that the county was pursuing or presenting an image of merger. And that may or may not have been 100% true either, but that was certainly how it was coming across. So the other thing that I'm not sure, 100% sure about when the chair's letters have to come to the board and when they don't. Maybe in this case it should have, because it, as you say, James, it's expressing an opinion. On the other hand, when the board asked that we write a letter about the testing issues to the province, we went ahead and did that. So that letter as a whole didn't come back to the board for approval. So it's a bit uncertain in my mind, and maybe when we look at our bylaw review next year, we can attain more clarity around the communication responsibilities. So I don't know where you guys want to go with this, to be honest. James, maybe I should give you a chance to just speak to your current feelings on these matters based on subsequent actions on the part of senior. And just the last thing I do want us to keep in mind, please keep in mind, as we learned at the training the other day, and as we perhaps we're already trying to always remember, our role on the board is to look at for the when we're sitting as part of the Renfrew County District Health Unit as a board member, our job is to be looking for what's best for the Renfrew County District Health Unit and the people of the area of Renfrew County and District in terms of public health needs. So that's one thing I want us to remember. And the other is that we stay at governance and strategic level of conversation and not accidentally get into operational matters which don't really belong in the public forum at a board meeting when they're actually the purview of our senior management team. So then, James, sort of with that as a bit of a maybe contextual setting from my point, if there's something that I haven't really addressed or answered for you, please jump in.
Thank you, Joanne. And yes, so I certainly appreciate having an opportunity to speak to the letter. And I wanted to say that when it comes to, and I want to talk about moving forward, because I certainly do recognize that there has been some good collaboration between the Renfrew County District Health Units and the county and some of the other organizations, mental health, the hospitals, the paramedics. I mean, the MESA project is certainly a shining example of a lot of different organizations working together. My fear is the fact that we are coming into budgets, and I know that it's always a challenge. Certainly for health units, we are getting a 1% increase, and we know that inflation, while it has come down with some of the recent reports, there still is a significant hangover from some of the increases that we've been faced with over the last couple of years. And I still think there's opportunity for the county and the health unit to work a little closely together. And something that just came to mind, it was part of what Troy was talking about, looking for more efficiencies. The Renfrew County has a benefits, and Peter, Jennifer could probably speak more to it. I think there's 7 lower tier municipalities that are on a benefits working group with the county. And this group has a voice when it comes to negotiating benefit increases. And based on the usage, because insurance is always about usage, in the last, I believe it was 2 years, that there was some significant savings realized in the benefit plan. And those savings then go back to the member municipalities as a premium holiday for a number of months. So again, opportunity there, in my opinion, that there's ways that the health unit could take advantage of some of those services. The county also does provide, and I don't want to say contracting out, but they provide lower tier municipalities some services through HR, through finance, where it may not require, or it doesn't always require, full-time staff for the lower tiers, but the county then charges out some of their staff to provide assistance in those areas where lower tiers don't have the budgets to put somebody in a position full-time. So those are some of the areas, and I know going forward, all of the lower tier municipalities have been hit with a significant OPP billing increase between 3% and 4% before we even look at our own inflation factors. We start looking at our own budgets. We're already facing a 3% to 4% increase to our budgets. And I know last year our Renfrew County Health Unit budget came in at around 11%. I don't know how realistic it is to expect the lower tiers to keep assuming those kind of budget increases. So I'll leave it at that, and maybe there's others that would like to join in.
Good, thank you, James. So my speakers list right now is in order of Jennifer, Troy, and then Peter. So we'll start with Jennifer.
Thank you, Joanne. So I'm going to leave the collaboration paper up to Peter. But I do want to address the letter. I don't believe that you should have to pass every single letter by the board. However, the letter that you sent was in direct opposition to what the board had instructed, which was to look for ways to collaborate with the county. And I want to defend the county. At no time did any one of us say that we were going to absorb the health unit. What we did say was that it would be an autonomous board, and we do have other examples of that in the county. So I think the challenge that's presented is, do I believe that you should have to run every single thing by the board? No, I don't. But I think that you have to stick within the flavor of the direction of what the board agreed to. And the direction was to look for efficiencies by utilizing, as James just said, many of the departments that we already have going at the County of Renfrew. In my opinion, this set us back because, of course, this letter went on county agendas, and I don't want it leaving a bad taste in somebody's mouth that it was to merge with another health unit or nothing. And I think that's where some people came across after reading your letter. So I guess all that being said, it wasn't productive in the end. When we had, I believe this board had a very firm idea that we would do what we could, whether the province would give us funding or not, that we would do what we could in order to alleviate some of the stresses on the staff of RCDHU. I also had a very interesting conversation offline at Roma with a couple of members that were talking about this forced merger. And the joke of it is that very few health units merged. And a couple of them that did merge were planning to merge prior to the province stepping in. So I'll leave it at that. Thank you.
Thank you. Troy?
Well, thank you, Chair. I do agree that we need to look at, every opportunity to create efficiencies and opportunities to save dollars due to our funding gaps. My only concern is, and as the governance chair, is, maybe we have to have a bigger conversation in terms of what, administrative structure would best meet our needs moving forward. Do we remain autonomous, or is it autonomous integrated, or is it, semi-autonomous board of health structure in terms of the administrative structure? So I think that's maybe the first step is to also look at, where do we think that we would see these efficiencies, and does our board of health administrative structure align with where we want to move forward to? And I think that's the bigger question. But I do think that's an opportunity to have those conversations and see, if there are opportunities or synergies. And, I was asking the question in terms of Dr. Morgenstern in regards to RAG, and, what are the opportunities coming out of that, that group? And, you talked about the financial components in terms of the bank lending opportunity. So if we continue to kind of leverage all these different opportunities, there may be some synergies or opportunities to, to save some dollars. But I think the bigger picture is that maybe the governance board needs to take that back as well and look at, what really makes sense in regards to the board structure moving forward. Do we remain autonomous, or do we look like an integrated autonomous structure? Thank you.
And Peter?
Thank you very much, Chair. And let me first recognize, I understand and feel the position you're in, because I'm in a similar position where I'm listening to people talk about the warden's letter, and sometimes, imposing my name on it. I did it, so there's no doubt about that. So I recognize that, the need to, you know, that you have to react and to respond firstly, and then secondly, also do it in a manner that's not bruising. So it was a poorly titled paper. I edited down too fine to make it look pretty on the cover, and I apologize for that. For me, I'd asked our staff to review models, and I wanted to ensure that when we walked in the door to sit down with our CDHU, that there was a discussion point, a starting point, and I had to pass it by county council first, and so it was a revival of some of the conversations that we were having prior to COVID, when we were supposed to make presentations. If you recall, the problems had talked about shrinking public health organizations from 34 down to 17, 14, 10, 12, 20. We weren't sure what the number was. And our position at that time was as a board, captured by what I've termed, and everybody else is, as the Yakabuski memo, because we'd made a presentation to John and we'd outlined how we thought we could make it work, which was and part of it did occur where we signed agreements with Ottawa Public Health to utilize some of their staff to be, in essence, an associate medical officer of health that could step in to be the acting medical officer of health when Dr. Cushman was otherwise occupied, either on holidays or medical issues. So, you know, that Yakabuski memo talked about other ways of going forward. And that at the time was a model where we were going to go with the city of Ottawa and with Ottawa Public Health, and the chair at the time of Ottawa Public Health agreed with the position because they too wanted to remain separate and didn't want to get caught up in the unorganized and maybe panic-stricken reorganization of public health that was going on. And so the idea was that we would purchase or MOU as many services as possible, which would show that we were gaining access to, and I'm going from memory, access to research, access to and sharing of epidemiology, which is already being done, I believe, across some portions of our Eastern Ontario network, or were until this merger stuff started again. So there were several things that we looked at. And then part of that, the Yakabuski memo, was also that we would take a look at pulling in services from other parts of our community, different sectors. So I asked staff to revive that at the county staff to merge the two documents, which was the Yakabuski paper or memo, and then also the previous presentation, which we were making to Jim Pine at the time, was heading up that review. So because I wanted to make sure that there was something to start talking about rather than just throwing stuff at the wall and everybody being frustrated. So sometimes I'm too aggressive. I recognize that. And I would encourage, that you ignore my aggressiveness and take a look at the ideas. And that's a starting point for discussion, because I think, as James has noted, I think we have to do something a little different here. As we've noted, our geographic isolation causes us many problems and challenges. The challenges are to deliver services across 10,000, or I guess it's 10,000 square kilometers roughly, that's very sparsely populated. And then, so that's a challenge. But some of the problems that we have are that we are not that closely aligned geographically, nor even in terms of our traffic flows with other health units short of Ottawa. And Ottawa is very clear they don't want to do anything more than be assistive, I think. So I think we have to look at something different. And sitting on the AMO Health Task Force at one point, became involved with discussions with regions who had the health units as an autonomous board under their auspices, and they did sell services internally. So that allowed more monies, program monies to be directed to the front line and less to administration. So very, I apologize for how long-winded and winding this has been. But it was not my intent to harm the relationship between the health unit and Renfrew County. And I would suggest to you that I deliberately did not respond and slow walked it into county council and reassured them that there's not an issue with the relationship. We have an excellent relationship with Dr. Morgenstern and staff, and and I find the board has matured as a board. It's much more open, and I certainly respect the style that you've brought to the board, chair. So I think in essence we can discuss the issues a little more. James brought some excellent points forward, and in terms of, Chair, if I might, in terms of your responding, I think it's a tough line to tread. I understand that, and so sometimes I get pressure to send a letter. So a rule of thumb for myself, and I expect Warden Murphy had the same rule, is that I try to color within the lines of previous council's discussions, and also step a little outside the line as I see our agenda moving forward. Facile advice, but it is helpful. So I think your letter respectfully probably should have came back, because it was a very clear declaration of policy. But that's a judgment thing, and I'm not going to question that. So thank you for your time.
Fair enough. Thank you very much. And I appreciate all of your comments. I really do. I think I tried in the letter to address the motion and support the motion in the third from the end paragraph, when I say that the senior management team will engage in further exploration of shared services with OPH, Ottawa Public Health, County of Renfrew, City of Pembroke, and Township of South Algonquin. So I was actually not trying to ignore or distance from the motion, and maybe I should have put that higher up in the letter so it was more obvious. And so fair enough. I really appreciate the comments. I wanted to know also, before we kind of try to see where we end up with, and I appreciate very much the concerns coming around budget. Peter, your hand is still up. Is that legacy?
That was just to repeat, to emphasize, yes, that your comments you just made, I pointed to those as suggesting, the relationship was moving forward. So I did.
Absolutely. Thank you. And certainly the work that's taken place since then really underscores and strengthens that reality, that the work of senior management with participating in the reactivation of the RAG group and the meetings that have been held with the City of Pembroke, Township of South Algonquin, and also County of Renfrew. I wondered, though, if Jason or Heather wanted to contribute anything to the conversation, since some of what we're getting at here is actually some of what we're talking here is sort of governance and strategic, and some of what we're talking is kind of operational. So I didn't know if either of you were desiring to add comment.
For sure. So, I mean, in terms of the operational aspects of collaboration, that is something that I think both Heather and I try to highlight in our reports. Ongoing collaborations or new initiatives, like just in my report today, I talk about the drug strategy work and how that and MESA and those types of collaborative initiatives, as well as the syphilis point of care testing, which is with Kingston Public Health. And there's a number of others that we could go into, so we do try to provide that feedback. But I mean, I do ultimately think that the outside of a governance aspect, which is within the domain of the board, but in terms of more operational shared services collaborations, Heather and I are always trying to work with partners to advance that wherever it makes sense. And I mean, since I've come to Renfrew County and district area, like, I think something that I've been really struck by is how collaborative it is here. I don't know if it's to do with us being more rural with a smaller population that it's easier, but I think it's just a lot of our leaders are very open-minded and have a partnership, they want to prioritize that and work together. And so I think that's been really heartening. So there was already, I would say before I came here, even a lot of good collaborations in place. Like one example is with we work with the paramedic service in many different ways, but for example, with the community paramedics and delivering flu immunizations. So Dr. Cushman for years had been overseeing the medical directive to support that, and that's something I've continued. So that's just one example. We're working together on a video with the paramedics right now to promote flu and COVID immunization together. And so we're always looking for these types of opportunities, and I see that as kind of in the operational domain. So I don't know if that's helpful. I don't know if Heather has anything else you'd like to add.
For some reason, we can't hear you, Heather. I know you're unmuted and I see your
Oh dear,
lips. There you go.
my headset was up.
There we
Sorry.
go.
Yes, I'm in agreement with what Jason was saying, and I don't have much to add other than some of the specific examples that James provided, and thank you very much for that. These things all take review and time to dismantle existing programs, if that were the case, and to reinvest and turn towards other programs, for example, benefits. So these are, again, more operational items that require further investigation. There is not a quick fix for many of these things.
And Peter's got his hand. And just before I go to Peter, I just will say, Heather, thank you for that, because what I just heard in your response is that you're certainly open and willing to look at all of those matters to see if there are savings to be achieved by bulk purchasing, and bulk purchasing of insurance is equally valid to bulk purchasing of paper, for instance. So that's great that you're open to looking at that. And I know you'll follow up and look more deeply at that hereafter. Peter.
Thank you. And I guess I should also reassure that I have not had any conversations with the Ministry of Health nor Ontario Health about any kind of a move forward with a closer relationship. I think that's something that those conversations, if possible, if something does occur, should come from a combined effort as opposed to me or somebody else leading the charge. So just to reassure, I know politics is an ugly business. But we do try to be honorable. So thank you.
Thanks, Peter. I appreciate that, and I agree with you wholeheartedly. If there was a move to go forward in some way, shape, or form, the most legitimate way would be in unison. As a togetherness kind of thing. Other comments or thoughts from anyone who hasn't spoken yet, especially anyone else have thoughts? Any other suggestions for going forward, or other things that you wish had been said by someone? This is your chance. I'm not seeing any other hands up. I do see a phone on my screen, 613. The last four digits are 0097, and I'm not sure who that is.
That's me, Joanne. It's Neil Nicholson.
I was thinking it might be you, Neil, and I thought I should just check, and I apologize for not doing that the moment I noticed the phone number. I think we were right in the midst of lots of talking, and so this was my first real sort of break to say welcome. And I don't know exactly at what point you joined, or if there's any comments that you want to make.
No, I apologize for logging on late, but I've been able to hear almost all the comments regarding the letter. And I think everything's been covered. Thank you.
James, are you all right if we move on to the next piece of correspondence?
Yes, I'm fine with that, and I appreciate the opportunity to address the letter, and certainly I appreciate your feedback, Joanne. And I mean, yes, I agree that the Board of Health has done some wonderful work to date and continues to evolve going forward. And I know for the new members on the board who don't have a lot of the history, I hope this helps in some way to give a little more information.
Thank you. And you know that you just reminded me again of how helpful the training was the other day. Partly for me, some of the training that was super helpful was hearing some of the history. Again, the Jennifer, I think you had to leave before they got into the where they did actually reflect back on the history and the TAN, you know, the 2019, those movements with Jim Pine, et cetera. And one of the things, again, that I took away from that was we have to try to remember to stay governance and strategic as best we can. If we've got questions or suggestions or recommendations at an operational level, maybe we need to talk about how we can filter that to the operations team without it being at a full board necessarily, when it's really an operational, like a great idea that's really something to be dealt with at the more ops level. So that would be something to think about. And what was the other piece? So it was the history, it was the thing about being strategic and governance. I think those were the two main things, but you did just remind me there of that in your remarks. So thanks, everybody. Let's carry on to our next. I messed up as usual. I wish you guys could see what I start off really organized and tidy, and by the time we get to this point of the meeting, I've got papers everywhere. So now I got to find my agenda again, which I have found. And we're into some of the other general correspondence. And Jason and Heather, maybe you want to walk us through any of the points while I find my other pieces of paper here.
I'm happy to jump down and talk about some of the public health content ones like nicotine, basic income, and safety of private drinking water. So for nicotine, we have just a letter of acknowledgement basically from Sudbury Public Health that's expressing their commendation to the Honorable Mark Holland for the order that they passed to introduce additional safeguarding measures around nicotine replacement therapies. You might recall that we discussed this, I'm not sure exactly when, a few months back, but there were concerns about this being marketed to youth and being overly available to youth and appealing, and potentially, taking youth down a path of using tobacco. So there have been some measures introduced there, including ensuring it's kept kind of behind the pharmacy desk, limiting the flavors that it can be sold in, and also curtailing certain, marketing efforts that were directed towards youth. So that's they're just sort of expressing their appreciation for that. Then the next letter we have is about basic income. It's from Halliburton Kawartha Pine Ridge District Health Unit, and it's basically expressing their support for two bills that are under consideration, S-233 and C-223, which is about developing a national framework for guaranteed livable basic income. And essentially, they point out the burden of poverty within their health unit area, and then also the health consequences of that. In particular, as it affects food insecurity, which, as we know, is related to many different illnesses, including mental illness, non-communicable diseases like diabetes, heart disease, things like that, as well as infections. And then noting their support for looking into a framework for a basic livable income. And then the last letter that I already mentioned is from Sudbury Public Health again, and just noting that they strongly recommend to the Minister of Health and to Public Health Ontario that we continue Ontario's well water testing program so that free service continues to be available to the many people who use private drinking water sources like wells, as an essential way to prevent gastrointestinal and other illnesses that can result from inadequately protected drinking water. And of interest, they noted that about even in Sudbury and District, I think about 22% of their population uses a private drinking water source, and that would be higher locally. So.
Back to Peter's earlier comments about how many wells are there in Ontario, it's probably a pretty high number, a pretty big percentage of, especially in the rural areas. Even in the city of Sudbury, it would be 22%. That seems large to me. That's like a quarter of the population is on well water. Are there any comments or questions about any of those pieces of, yes, James?
Thank you, Chair. And I'm just wondering if I'd like to make a motion that we support the resolution on the well water testing.
And Ethel is got her hand up, and so does Peter. So maybe Peter, you were first, and then Mayor LaValle.
Yeah, I was going to second it and then speak to it.
Yeah, okay, and then Elder Ethel.
I was doing the same.
Yeah, okay, so there's a lot of, I was thinking the same thing too. So there's a lot of flow of support, and again, encouragement for our board to send a letter of support on the well water testing. I know that, you know, I'm trying to avoid the impromptu motions that might require staff study ahead of time. So I'm going to look at the staff first to say, in terms of sending a letter of support, do you feel that's an appropriate thing for us to do now, or do you want this to be like a notice of motion and all of that? Thanks, Jason.
I mean, I think that as we've discussed before, we've discussed this topic before, and I think the board's been largely in agreement. So perhaps we could just move forward with it.
Okay, so do we even need a motion? Can we just do it? Do you guys really want a motion? We can put a motion down if you want. I guess you like the motions on the record. So who said it first was James. So James moved it, and Ethel was waving her hand almost at the same time as Peter. Sorry, Elder Ethel, can we put you down as a seconder? All in favor? So we're directing staff to draft some content for me to send on behalf of the board to support for continued well water testing for our rural residents. It's really, and I appreciated hearing from both Jennifer and Peter, and I'm sure the other elected municipal representatives will do likewise to continue to bring this issue forward at AMO and Roma, so that we have, because that was another thing that was really made clear to us the other day with the training. And I think we did already know this, and I think we were already doing this. It was a good reminder to work closely with AMO and Roma in communicating our needs and efforts forward, because we do need to make a united front to the decision makers of the provincial government in order of protecting our residents and our rural communities. So that's good. The thing that I was looking for, that I now was ready for, I had needed those couple of extra seconds to organize my papers again. It was the Alpha Info break, and I know Peter made reference to it earlier in terms of the workshop that he had noticed, and I know that a number of us are attending the Alpha Fall Symposium next week, and I'm really looking forward to that. And I noticed also, and it was something that they talked about in the training, the resources available on the Alpha website. And their info break is not, the pages don't print out numbered for me for some reason. So I'm not sure exactly what page that's on, but they have boards of health shared resources and the tools. And then they also, I'm a little bit curious about the Public Health Sudbury District's Undoing White Supremacy and Racism project. So I'm going to try to learn a little bit more about that myself. And then I was interested in looking at the resources available on the Alpha website, where they've got things like maps with boards of health types and list of units sorted by municipality and list of municipalities sorted by health unit and just different things like that. And I don't know whether each of us actually has access to those or if we always have to go through Melissa. And maybe Heather, does anyone know? I mean, and Mike DeManoir, I think you've tried to get into resources on their website before without success. So I just wondered, just for the education of our board, how do we make the best use of the Alpha resources as board members?
There is a board member portal, like site for board members. And then if there's something you need that you can't access, then reach out to Melissa and we can get it.
Maybe if we have time at some future board meeting, we could put that up on the screen and show. Does everyone on the board know how to do that? Have other board members done that? And I'm going to just make an assumption that maybe not 100% of us have done that, and that maybe showing it to us on the screen could be good at a future meeting. I see a couple of heads nodding, so that might be an action for future board education, is just to orient to the Alpha website. It was great that she brought it up and showed us a little bit of it while we were in the training session, and that kind of got me thinking that maybe we could benefit from doing a little bit more of that. And I was interested in the answer to the question about the types of boards and, the autonomous, the semi-autonomous, and learning that many boards are moving away, or some of the municipal or regional boards are kind of moving into some sort of hybrid or semi-autonomous, like the Hamilton board and that kind of thing. And I am interested and curious just to see, what is the future showing us in that regard, and what is the best practice going forward going to be, and who determines ultimately that? And those are just questions that I have that can be looked at for the future. And as Troy so eloquently identified, this could be something looked at through governance. And I know that next year we're due to be starting a big refresh again on our bylaw for 2025. So I feel that the timing will be good for us to look at these different questions while we're going through the bylaw process in any event. And that, as I said, is on our agenda for next year. So, okay, now I've lost my agenda again. There we go. Here we go. All right. So that took care of correspondence. Any other questions? James, yes?
Thank you, Joanne. And I just wanted to follow up what you were saying on some of the things you were saying. And again, I think it's certainly worth exploring, different approaches to governance. And I'm wondering as well, just following in that same line of thought, should we as a board be sending a letter to the Minister of Health to say, we took a really close look at a merger. We didn't see how it could improve our delivery of public health services. But here are some other avenues we are exploring. And, is there any funding available? Because we are still searching for the best possible outcome for public health for our residents.
We take some time to contemplate that suggestion. I think that's, I had myself been wondering in terms of the post-mandatory, or, well, it wasn't mandatory, but it was certainly incentivized merger between health units. And as they mentioned, and I do see your hand, Jennifer, and as they had mentioned in the training, none of those mergers have actually been formally approved. And we don't know exactly what's going on behind the scenes. And of course, we also have the officer of the chief medical officer of health, and I wondered if, and this may be something that Jason could follow up also to find out can we get any idea of where that's heading before we actually write something to somebody, and give some strong consideration as to what we should or would write and to whom. And Jennifer?
Thank you, Chair. That is exactly what I was going to ask. Does Jason have any better intel than we have on the mergers? But I will caution that this particular Minister of Health, once she has presented an idea, and I'll go back to the community safety and well-being plans that aren't worth the paper they're printed on, once she sinks her teeth into something, I feel like it's all about her succeeding in whatever she's put out. And I'll be very interested, if we do send a letter, I'll be interested to see what the response is, because I know what the responses were to the community safety and well-being plans. But definitely, I'd love to know if Jason's got better intel.
Before we go, I don't know if we should go to Jason first or actually let Peter go. And Jennifer, is that your puppy?
Yes. Yes.
You got to put him on screen or her on screen. Okay, Peter,
Well,
you go.
there are two of them, but this is Quinn.
Oh, she's beautiful. Thank you. All right, Peter, you had a thought too, and then we'll get to Jason.
Yeah, again, that's something I'm raising at AMO regularly. Again, at the end of the month, just saying that 1% is an effective way of strangling public health. It's not sustainable. And again, as far as I know, there's only 4 amalgamations that are taking place or have taken place, and the government was somewhat surprised by the low uptake. And I think have cautiously reached out to ask some questions. I don't know who they've asked questions of, but I intend to find out more information. I'll bring it back as fast as I know it.
Thank you. And Jason, if you had any more intel.
Unfortunately, I don't, other than to just confirm that there's still haven't been an official response to the merger submissions that have happened. So I know that the involved health units are still, working with that in mind, but it's certainly delayed from what we would have expected with the timelines that were proposed in terms of January 1st and et cetera. So, but once we know more, Heather and I will update you in our next meeting if we do hear more. So.
The other thing that we heard the other day, sort of on that note, was that the standards, which we were supposed to receive in September, I think it was originally, have still not been released. And I think what they were saying was that they don't expect now to see them till sometime in early 2025, maybe. And so it's going to be, it's been pushed out quite a ways for implementation and planning, right? So.
Yeah, that's correct. Yeah.
And then we have no, for the procedural bylaws is just a standing item on the agenda, and obviously that's going to
Chair,
be.
if I may.
Yes.
If I may, I think that the implementation's been pushed out because it was sort of ill-conceived to make it punitive to those of us that didn't merge. I think there's, I think honestly, the province is surprised that we didn't take the carrot, i.e. the money. But when it doesn't make sense, it doesn't make sense. So I'm not surprised at the delay. Thank you.
Good point. We have no new business on the agenda, so that would bring us to the action list, which I can't find in my papers right now because I've made too much of a mess of them. So I'm going to ask Melissa to put it up on the screen. So the CHEO, there's still, our presentation on the Kids Come First is still outstanding. Database for future delegations, there's been no action on that one, so it's just on the action list. The letter of support to the Peterborough Health Unit, I don't believe that's been accomplished yet either. So maybe when we're on the letter writing campaign this month, we'll get that one taken care of now that we've added the letter of support for well water testing. Shared services. Okay, so the meetings have been completed and now the work is ongoing for looking for further efficiencies and savings and partnership. And I know we've seen partnership proposals get developed. So that's another way of helping to address the funding crisis, is get new money and get it together and help everybody. And the Board of Health meetings on YouTube are now active, which is amazing. So I think that is a review of the action list for this month. The other thing that I want to put, I see your hand, Peter, I'm going to come right back to you. The other thing that I want to make sure is on, I don't know if it goes on I believe it should be on our action list for next month to make sure it gets done too, is the board self-evaluations. So I am going to just take this opportunity to remind everybody to try to do that. If you're having any trouble opening the file or completing the questionnaire, please get in touch with Melissa. She can arrange to print it out for you so that you can fill it out longhand and hand it in, like whatever it takes to make it possible for you to do it. That would be greatly appreciated. Peter.
There we go. So yes, on the self-evaluation, I will confess to being lazy and not doing it. I will work on it. And I was a little slow hitting the hand on new business. Just very quickly, the warming center is is going to be operational. We're targeting November 15th through until April 15th, so for 5 months. There'll be more information sent out to all partners, and a location will be confirmed. As Troy will recall, I'm meeting with his council this afternoon in close to hash out the final details. I think he'll be pleased with the presentation we're bringing, and then we'll announce something public. So at this point, I still chair the ad hoc committee, and of course we value what Dr. Morgenstern and Patty Smith have brought, and other people at various times, and we will continue to rely on them for advice. So just a very quick update on that, and if I could suggest at some point in the future, if we could have a presentation with regards to Mesa, because I think we've thrown those words around. So there's 4 or 5 of us know what that means, but the rest of the board may not. And then also, at some point there may be some information to talk about the Heart Hub and what it looks like. So those are 2 significant events that I think are information items for the board. And for staff too, I think. So if I could make those suggestions. Thank you, Chair.
Thank you. Excellent. We can add that to our action list. Good. So there is no closed meeting on this agenda, although we will have to have it at some point. When we have our next closed meeting, it'll probably be around the time that we're looking at budget, et cetera. Whether it's next month, or I believe it would be next month that we'd be doing that. I just was in my brain thinking that we've got to always remember to approve the minutes of our last closed meeting at that time, because I think the last one was back in April or May or something. So our next meeting is Tuesday, November the 26th. And that being the end of the agenda, I could call for a motion to adjourn. From Peter, seconded by Mayor Lavalley. Thank you very much. All in favor? That's carried. Awesome. Great meeting, everybody. Thank you very much.
Thank you. Take care. And thank you for
Bye.
indulging my long-windedness.
Thanks for all that you share.
Take care, everyone. Have a good day.
Get my view.